Welcome to Muscle Fix Mobile Podcast. Today we have our regulars, Dr. Vincent Tefuri, Doctor of Chiropractic Care and knower of many things. We have Dr. Nicholas Kufmanoski, Master of Cupping. And we have Dr. Shah, esteemed guest of Dr. T. Welcome to the show, sir.
Hey, guys.
Welcome.
Good evening.
So if you could please just, give us some background. Tell us about yourself. What brought you into medicine? What brought you to meeting Dr. T? How are we all here today, I should say?
My perspective and approach towards medicine came early on in childhood. A lot of exposure to doctors. I was born less than 2 pounds, so I was in and out of the hospital for years and years and years growing up, and always had very positive experiences. So went into healthcare wanting to do some of the same, and fell into neurology kind of in a funny way. I went to my undergrad at Cornell University because my best friend said, you got to go to Cornell, and so we went together. And once there, we had to go through the requirements for biology, and I learned that the fewest requirements within the degree of biology were for neuroscience. I'm like, let's do that. But we fell in love with it, and we did a lot more than was the minimum required. And then we went off to med school, into different medical schools. And then when it came time for residency, I really loved everything about healthcare. So I decided to do primary care. And halfway through my first year of residency, that same friend called me up. He's like, why aren't you doing neurology? And I'm like, good question. So I looked around, there were openings, and I jumped into a Mount Sinai residency in neurology. So I completed that and then went on to do fellowship before coming back to the New York area to start up work in private practice. Pretty quickly, I learned that private practice in our healthcare system is completely broken and very frustrating. So on the side, I did a couple of software companies and startups that I developed in terms of other businesses to actually bring in some income while I could treat patients the way I really wanted to, with the respect and care, and not seeing 70 patients an hour kind of mill doctor job. And met up with a nutritionist friend that together we created a holistic neurology practice, one of 3 such practices in the country at the time. It was based in Mount Kisco, and I was there from 2007 through 2015, working hand in hand with the nutritionist, personal trainers, and other healthcare experts that really looked at every neurologic disease with a holistic approach. So we recognized early on that Western medicine, while it has some great things, does not have all the answers. It's not just take this drug and you'll get better. Take this drug, you'll get better. So I really developed a philosophy of a multimodal approach to the patient through the use of acupuncture, chiropractic, physical therapy, nutrition, vitamins, general well-being, meditation, all of those things. So to this day, I continue to do that in my practice, where I literally will write a prescription for a patient for meditation. And while they're in the office with me, pull their smartphone out, find what Android or Apple, and find a good app for them, download it, show them how to use it. And I make them say that, 10 minutes a day for the next 30 days, you're gonna use this app. Just try it. And in addition to that, let's work on your health. Let's work on your well-being physically, not just emotionally and mentally. And sure, there's a role for medications that I certainly find it very useful for various conditions, whether it's dementia or headaches or Parkinson's disease, multiple sclerosis, and the like. But I don't think that my medication prescriptions alone does the trick. So that's where, working with great friends like Dr. Tefuri or Nick really can make a difference for many of the patients, where they need that approach from every side of their health and every side of their life to really get themselves to feel better. And that's what we've been doing, and what I've been doing for about 15, 16 years now in my own practice is finding other partners like Dr. Tefuri and Nick.
Wow, a lot to unpack. You wouldn't think that you'd have that same experience that general practitioners have, or that other disciplines have of the puppy mill of just, in your expertise in neurology, that is, seeing that many patients per hour, as you said, is the experience of many. That was what turned Nick off the most from working in the big clinics, was just churning people out without giving them the proper care that each person really needs to get better. And that ultimately, like yourself, led him and eventually me to drift towards this whole holistic medicine world, which I think, like many Westerners, had a general negative perception of it as being, quackery, as being very pseudo-sciencey. But in reality, there's tons and tons of science behind, say, just cupping, in the East and China and the former Soviet Union, like tons of research, and it's been around for thousands of years. So that said, like, what validated it for you? Like, what made you start going down that path? Was it seeing the negative effect of medication, pharmaceuticals? Was it because other people you respected were into it, or what happened with that?
Yeah, well, from my experience in the world of neurology specifically, until a few years ago, we had such few treatments that were really effective. The brain is a big black box. And so when it comes to migraines, to this day, we say we don't know the exact cause of migraines, for example, but we have this drug and this drug and this drug, and they make some benefit, and this one has some benefit, and this might help a little bit, but they also have side effects because they're all strong and powerful chemicals that really can affect the body. Across the board, Parkinson's, multiple sclerosis, epilepsy, in every area, we have imperfect treatments. We don't have cures for dementia or Parkinson's or MS. We're getting close, we hope, but we didn't have the solution. And in working with my friends in other modalities, whether it's nutrition or chiropractic, I learned that, we each have a role to play to add to benefiting the patient, benefiting the nervous system. And keeping a closed mind helps nobody. And that's where I quickly learned that, getting the help of my friends and colleagues, we can really bring a patient not just from, 10% function to 60%, but we can bring them up to 70, 80, 90%, which is incredible. And we'll take every point that we can get in terms of positivity. And I think that our healthcare system is geared around a payer system from insurance companies that really kind of screws patients. It's actually really not beneficial to the patients if it limits their access to other types of treatments that haven't been validated, mainly because only the pharmaceuticals have the strong lobbyists in Washington to get them to pay for these big drugs. But, the role of holistic approaches, they don't cost much, but they still have an expense associated with them. And yet, if insurance doesn't cover it, how much out-of-pocket expense can you expect for a patient to cover on their own health when they're already paying for insurance and they're paying premiums and they're already doing things? And I think that's one area where we really have to focus and try to change the thinking of this country. And maybe that's going to happen a little bit because of this pandemic. People are realizing that, Western medicine, we're throwing trillions at vaccine or a cure or approach towards the lung disease associated with COVID. Money is not the solution, and that Western medicine doesn't necessarily have all the answers. Yeah, science-based approach is very good, but you can have a science-based approach to alternate care too, not just pharmaceuticals.
Well, I think if it can't be patented, they don't care, basically, in terms of what the big pharmaceutical firms, how they view things. And it's the same thing with ghosts that are employed. And likewise, what you're describing, and Nick can speak to this a lot, so feel free to chime in there, buddy, that has literally been our experience right now, is going from what the insurance companies would pay for his patients, which is to basically bring someone to some level of being somewhat okay over an extended period of time, like maybe 10 to 12 treatments, versus the astounding, like maybe 80% better that some of his patients have claimed to have felt in one treatment, like one or two really solid, sessions where Nick's able to treat them to full capacity versus following the very limited protocols that he would have to follow at the larger, healthcare clinics. So Nick, I don't know if you have
first and foremost, this is just mind-blowing that an Ivy League Cornell superstar neurologist, this is the first time I'm hearing that. So thank you for educating and coming on and giving this information to the world, Dr. Shah, because I've never heard it so well put. And even from a PT perspective, the peons that we are patient-centered. And the MDs and the traditional medical field, we've kind of looked as redheaded stepchilds, as like Dr. T likes to call us. And again, having that patient-centered perspective, I was embarrassed to treat friends, family, and patients with our current healthcare system limiting to 12 visits or what the reimbursables were. So I had to tell Mrs. Jones with her knee replacement that, yes, Mrs. Jones, you get 12 visits for your knee replacement as she's still in agony, limping away with her walker after surgery. So my job is to treat patients as Dr. Shah does, not their insurance. So the financial limitations, and we're so accustomed to that, if my insurance doesn't cover it, well, maybe I don't need it, or I shouldn't do it, or I'm not paying for it, God forbid. But Dr. Shah is leading the charge in the front line from the real deal medicine and the neurological level. And we're following suit, I think, with the PT and chiropractic right behind those type of great doctors and that we need in this country and in this world for that matter. Western medicine and American medicine kind of turned me off to medical school and Cornell and the fancy Ivy Leagues because I didn't believe in take two of these and call me in a month. Somehow intuitively, I knew the limitations of that. So as I personally discovered the powers of essential oils, cupping, and just giving the blood flow to the right areas for our bodies to miraculously help maybe heal itself and, God forbid, shall we say, cure itself, is very, very powerful to see that. And one thing that really, really intrigued me about Dr. Shah, and I've met him for a whopping 3 minutes, he believes in a lot of IV, vitamins, and other non-pharmaceutical treatments. So maybe you could expand a little bit more, because I've been thinking about it since that day we met, Dr. Shah, about kind of what your medical perspective and Ivy League background can shine some light on that.
Yeah, well, actually, as I said, I worked and created a holistic medical practice where we performed a lot of non-traditional treatments, such as using hyperbaric oxygen chambers for our patients and intravenous drips of various cocktails of vitamins. And for patients with unique diseases where Western medicine hasn't delivered anything yet, it was incredible. For a simple example, we had patients with Lou Gehrig's disease or ALS. And right now, we have nothing. We really have nothing for these patients. The drugs that we have slow down the disease process a little bit, a few months of extra life at best. And the truth is, the quality of life is not really improved by those medications to any significant degree. In my clinic, when we were able to identify these patients and see what nutritional deficiencies they had and imbalances, what we did was we would create custom cocktails of various vitamins in high doses. And some people would think that that was absolute quackery, but we never went out of safe boundaries, and people would come in on a weekly basis or sometimes twice a week for IV therapy. And yes, they'd be hooked up to an IV for 45 minutes, 1 or 2 times a week. But the remainder of their days that they had, some people felt that they had a much better quality of life, much better existence because they had better energy, better balance. And who knows if we even slowed down the process of degeneration that was going on. I can't say for sure. We didn't do clinical trials in terms of like, okay, you're getting all the vitamins and you're not. And, let's see what happens. Because in such a situation and with that type of disease, it's like every man and woman for himself. We just do everything we can because it is a death sentence, unfortunately. And so from that perspective, I think that we have a lot of areas of healthcare and medicine where there are severe imbalances caused by disease or causing disease that are overlooked when we don't look closely enough at the nutrition. And by looking at the nutrition, we can get an idea of what's going on and try to balance that out better and help the patients through those approaches.
Do Do you personally do any IV treatment yourself, or what do you recommend for dad bod like me, or where to begin? Because I'm days away from starting my first IV. I work closely with some other clinics and treat some of the patients. That I'm like, it's like all the big talk. All the cool kids are doing IV now, so I want to be part of the cool kids club. So where do I begin?
Well, I think that it's tricky because, again, you have to find the protocol that's best for you and your needs and what other health conditions you have. And literally, me and my nutritionist would sit there spending 35 minutes, an hour on a patient, going through their history, going through their labs, going through the vitamins, their supplements, everything, before we could come up with a customized formula for any given individual. And it wasn't just, okay, here, we plug you in and you're good. We would have to update it and revise it on at least every month or every quarter, because as the body changes in response to those IVs, you have to modify the formulas that you give them. But it's usually a combination of high doses of many of the vitamins that people have heard about in terms of the B vitamins, vitamin C, and other nutrients that can be given intravenously. So it's not just about hydration. Although we are very underhydrated as a society, just because we don't have time to drink enough water, and we're like, okay, you know what? I don't have to be peeing every 5 minutes, so I'm gonna stay dehydrated instead. But I mean, that's the simplest thing, and you don't even have to do that IV. Just carry some water around and make sure you get through a good amount of water every day. And that's the first thing to start with.
In talking about nutritional therapy, I think the important understanding is that we all sustain ourselves by eating the right things. And unfortunately, as you know, the standard American diet in this country has changed dramatically over the last 30 years, especially our food. What's in our food, the nutrient value, and the adulterants that are put in, the preservative values from the things, including sodium chloride being typical table salt to high fructose corn syrup. And then we get into the whole area of genetically modified food where the body looks at this stuff and say, what in God's name is this? So the adaptation effect of a human being to sustain themselves, okay, on the nutrients that are being taken into the body have been challenged dramatically and have considered, once again, it's that entire triad of what we look at in the world of, the food that we're ingesting, the pharmaceutical intervention, the medical intervention, and it's that whole triad of different things. So I think people are becoming much more aware and conscientious about, we go back to the basic tenets, let your food be your medicine being your food, as Hippocrates said many, many years ago. So the reality is that we have to really take and be conscientious about that all the time. In being even something as simplistic about we're not only dehydrated, but we're minerally deficient. And why is that happening? Well, let's just think about it. The overabundant use of herbicides, pesticides, and synthetic fertilizers destroyed the microorganisms in the ground that took a rock and digested and spit out minerals. So the plants are not absorbing the nutrient levels that they had before. And as a result of that, that thing that looked like a great healthy piece of fruit or vegetable just doesn't have the combination of the right nutrients anymore. So supplementation has become a paramount factor. And we know that even that's a limitation based upon the ability to digest. And as we get older, hydrochloric levels go down the gastrointestinal tract and the stomach. The enzyme production in the body changes too. So as we said, this is a multifocal approach to really getting a person to a better state of health and function. If we focus on that, treating the body as opposed to the body, then it makes a significant difference in the outcome, regardless of what the disease definition might be. And I think it enhances the ability of different things and protocols that we could utilize within the context of conservative medicine, and as I say, more of the complementary effect, of getting a person back to a better state of health and function. And I know that was the thing that drew us together 10 years ago. And we've been working together to try and make that happen with our patients. And we still do the standard, neurological workups and things of that nature, as you see, when we see a patient coming in. But the reality is that let's find what works the best for each individual. And it comes to be a customized situation. And unfortunately, as you know, that has not been the approach, especially now in this crazy world. And I think it's obviously going to even get worse with the adjunct aspect of what we've seen now with COVID and telemedicine, where persons can spend 15 minutes on the tube and basically be able to be given something. And most of the time, as you know, and as it's happening, it goes in the pharmaceutical direction. So it really is going to come down to patients being well educated. And that's the challenge when you're looking at TV at night and being bombarded by a chameleon, Papa John's, or something of that nature, and then the pharmaceutical intervention that they tell you about all the myriad of side effects, and people don't even hear it anymore. So it becomes a key factor to find physicians like yourself, myself, Nick, what have you, to try and integrate that whole thing in. And
I
it's
think
been
you're
an interesting experience, right?
absolutely right. I think that people need to take more responsibility for themselves and their own health. I think that we're giving that up as a society. We're like, not my problem. Okay, but you have diabetes or high blood pressure
Right.
because you haven't taken care of yourself.
Right.
Now, before it gets too late, it's still reversible, but it's not reversible just with a drug. You
Right.
have to change your lifestyle. Wellness
Yeah.
really matters. And when it comes to like Dr. Tafuri, your wellness coaching and your guidance for weight loss, I think that people don't realize that it's not just about losing the pounds,
Oh, no.
but about reshaping the body in a way that metabolically it's stronger. All the systems are revved up and ready to go and fight infection and fight disease on their own. The body is tremendous at healing if given the right tools and right guidance, which too many people are saying, give me a pill for that. And that just doesn't work.
Yeah, it really becomes, as you said, getting the patient involved. I tell my patients, say, I'm the coach, you're the quarterback. You're never going to be able to run that play appropriately if you don't start listening to some of the things that we tell you. And the thing is I don't have all the answers, but I say, I'm more aware of what your body needs than we've typically seen, and we need to make some significant changes. And when we focus on the wellness component, let's say we do change their diet, use nutraceuticals and different things of that nature, we're starting to see significant changes happen in gut health, which is a paramount factor in everything. So the fact of the matter is that if we want to see blood sugar balance out rather than just throwing medication at them, we really have to make them conscientious about what they need to do to change things from the inside out, necessary from the outside in.
So Dr. Shah, so to translate all this to our viewership, translate this quickly or in a few bullet points. What can we start today to prevent some of these real deal diseases that you see daily and scarily and tragically at times? What are some, I guess, nutrients or herbs, even, or teas that may possibly help us? Or is there such a thing, or am I crazy thinking that?
Well, no, I don't think you're crazy. It's just that finding the right formula really involves, I apologize, I'm on call for the hospital, so they keep calling as well. 1 second, I apologize.
He's a real doctor, ladies and gentlemen.
All set. So what it really comes down to is it's not like there's one tea or there's one nutrient. I think that what Dr. Tafuri said is exactly right, in that our macronutrients are becoming crappier and crappier. So just because you're eating organic does not mean you're getting everything you need. That's part of the problem. Like, I'm vegetarian. I've been vegetarian all my life, and we try to get the best, freshest foods that we can, shop locally, from local farms, things like that. But the reality is we're still not getting the nutrients that we need. And from that perspective, yes, eating the superfoods like quinoa and things like that doesn't hurt. But I think that getting nutritional assistance requires professional help, to be completely honest. I think that, we can go ahead and buy some vitamins over the counter or eat some foods but trying to get to that place, unless you have an expertise or degree in it, or a much greater understanding than the average person, I think that the average person really should seek out help for the long term. It doesn't mean that you have to live with us, but check in with experts that keep on top of the latest research on nutrition and wellness. And staying healthy involves exercise too. I mean, that's an extremely important part of the formula, where people just have to just get off the sofa. And patients ask me, okay, I'm walking 4 miles a day. And I'm like, you know what? If you were 99 years old, I'd say good for you. But walking is not exercise. It's not enough. Good. Get out of that freaking house. Get off the sofa. But you need to sweat. You need to actually do stuff. Weights and cardio. And walking does not cut it unless you're on a treadmill and you hit like 6 or some speed that's like going to push you. So I think that people have gotten too sedentary with screens all around them that are drawing their attention like chipmunks. They're like, ooh, I could watch this, or I have a Netflix queue to catch up on, or something like that. And, it's just as important as good nutrition. The role of exercise and physical activity and exertion, which people forget. But if you're having pain, or you're aching here, or a slip disc or something, that is going to limit you. So get that work done, get that fixed so that you can then get out and do what you need to stay healthy and let your body repair itself and cure itself and heal itself.
Huge factor. One of the things that I've boiled down the focal approach of dealing with patients has been 3 areas. I call it the triad, and it's an equilateral triangle that keeps itself in balance. That's structure and function, biochemistry and toxicity, and emotional well-being. When one goes off, it affects all others. So I tell patients that life is balanced, and you have to be conscientious about it. You can't drop your body off at 9 o'clock at the doctor's office and pick it up at 5 o'clock. You got to be an active participant for the rest of your life if you choose to be healthy. Now, you could be proactive, which is what we're talking about, or you could be reactive, which basically means that you're going to just keep waiting until the ticking time bomb explodes on you. And of course, it's a much more compromising situation to be dealing in the depths of illness. And that's unfortunately where many patients have gotten themselves to. So we really need to adapt, let's say, for lack of a better term, the Eastern mentality, okay, the Asian medicine that basically says, okay, I keep you healthy, because that's the way it used to work. You went to the doctor, if it's an old term, Oriental medicine, Asian medicine, and basically he got paid to keep you healthy. When you got sick, you didn't get paid. So the reality is that you got to help, but you got to be involved, and you got to start looking at what you can do. And I advocate the fact that you're talking about all these different things, which is, as you know, within our brethren of healthcare, this is something that unfortunately still is not coming across the way it needs to. You've got to take care of the body. And if you take care of the body, it'll function better. And you got to feed it the right thing, and you got to be able to cope, not stop the stressors that go on to bring your body to a better state of health and function. So we're talking about neurology. We're talking about the brain, the nervous system. We're talking about obviously reducing interference through chiropractic. We're talking about physiological limitations and working in the realm of physiotherapy. And we're talking about getting the right balance of the body's ability to function and heal through the approach of both conservative and complementary medicine. And that's where it is. So we really need to shift that paradigm. And it's paramount for us and other practitioners like ourselves to continue to get that message out across.
Dr. Shah, when I first started working with Nick, one of the things that convinced me that it was more than a placebo effect that people were experiencing was another friend of ours, Dr. Mohammed Badri, who is a foot surgeon, to keep things short, actually called Nick and he said, I have clients who are seeing you and they're seeing much increased healing, basically, as opposed to his other patients. He was asking Nick, what are you doing for them? What's this like secret sauce that is, increasing magic, pure magic. So that being said, in your field, in neurology, have any of the treatments, nutrition, or any of the other holistic approaches you've taken created a discernible, measurable improvement in your patients that you're treating for neurological disorders or the like?
Oh yeah, absolutely. I mean, I like to give the story of this wonderful 86-year-old lady that came to me with a walker and bent over and stooped and whatnot. And she had what turned out to be a chronic inflammatory demyelinating polyneuropathy. Quite a mouthful, but basically an autoimmune disease that attacked her own nerves. And so I said, okay, we have ways to help your immune system regulate itself better. And one of those things is a naturally occurring protein called gamma globulin, or IVIG. But that's not going to work alone in a bubble. You're going to have to do things for it too. So we got her a medication. She got weekly infusions of this protein that is naturally occurring in the bloodstream called gamma globulin. And then I stressed to her nutrition and exercise, and I sat with her and I went through all sorts of diets and approaches and exercise. And starting the next week, she took her rolling walker with her into the swimming pool and started doing laps in the pool. So, the resistance of water. So when people say I walk, I tell them that walking is garbage, but walking in water, for example, at least that's something. Pushing against the water, good resistance. You're not hurting your back or your joints because the gravity is eliminated, and there's balance therapy because there's waves. So I got her in the pool, and she literally did an hour a day in the pool with her walker initially, along with nutrition, along with some Western medicine. Honest to God, age 87, she came back to me, walked in the room, hopped up on the exam table, no cane, no walker, no aid, nothing. And now this 87-year-old lady is like, you know what? I'm chasing my great-grandchildren around and having so much fun. And only happened because she didn't do just the Western medicine, but she took into account the critical importance of exercise, diet, nutrition, watching her vitamin levels. We did blood tests every quarter. We saw where she was. We're like, oh, you need to bump up the vitamin D a little bit, and here's the foods that have it. Plus, take a vitamin supplement if you need. It's easier. You can't just sit out in the sun all day. We live in the Northeast, so that's not going to do it for you. But it took concerted effort on her part to meet the guidelines of all the non-traditional, just drug, pill, go ahead type of approach. But even at age 87, the human body can heal so tremendously, and the nervous system can recover. Stroke victims can regain so much function, but not in a vacuum. They have to do it with the guidance of a physician, but also with the guidance of physical therapy, nutritional therapy, occupational therapy, an exercise or trainer coach, all sorts of approaches. And, even like the role of cupping to help in terms of the muscle spasms or blood flow issues that they have after the stroke. There are so many things that can be done to the body from the outside that will help it heal itself, but it takes drive from in here too.
I think it also, the important fact is the presentation. How many people are actually presenting this information to the patients so that they know there are other things that could be done? And unfortunately, that is limited in Western medicine, but physicians like yourself have integrated in to bring that to the patient and look at the miraculous changes, as opposed to just labeling with a disease. It's an autoimmune-based problem, like for the audience right now, the body attacking itself. What can we do to increase the potential aspect of the body healing itself? Because everything heals, okay, from the inside out. You cut yourself, basically if your body's not functioning properly, it doesn't heal. If you're a diabetic, it takes longer. But if you start to change the inherent ability of the body to heal itself based upon all the things that can be done, and some of them very simplistic, which gets down to the whole aspect of why it's not being presented, the economic value, because holistic medicine, right, doesn't make big bucks. That's the one thing we know. But we still get out there and we do it. And it's a passion, it's a drive, just like for yourself and myself for all the years that we've done it, because we see the results occurring. That's what's happening with people.
Absolutely.
We have to get that message out there more and more. That's why we do these podcasts. That's why we try to integrate all different practitioners coming back in. We've had people on here talking about emotional issues and different things going on. And you know what? It's all part of the big picture, helping people.
Clearly. Absolutely.
Cool.
Excellent. Well, this has been a lot of fun. I appreciate chatting with you guys about our shared philosophy and
Definitely.
my approach and take towards it. So thank you so much.
Well, we appreciate you. And I can tell from my personal experience in working with you, you've probably been one of the primary practitioners when it comes to a neurological deficit. I'm going to consult with you and have my patients come to you because you're going to basically tell them more of a realism as opposed to let's do this, let's do another test, let's just push and manipulate. Don't you find that in a traditional sense, patients just go from one person to the next person to the next person, and they basically say to you, it's like, I've been down this road before. That's how they get to me most of the time in my approach, okay? And they say, no one's been able to help me. Why is it that you've been able to do something for me in the short period of time that we've been working together, that I'm starting to see some hope about getting my health back? And that's a critical factor that needs to come out more and more. And you're doing that, and I'm doing it, and Nick's doing it, and there are plenty of other doctors out there doing it. So we want to bring that message to the public that you have to find it. It's not going to walk into your lap typically. And the best thing to do is speak to your friends, your neighbors, your family about those practitioners that can obviously make a difference in your life to help you.
Exactly right. Thank
There
you.
you go.
Dr. Shah, tell us about your new place. I had the luxury and the pleasure to come into that place, and I was blown away, to say the least, not just by kind of you, but the practice itself. So tell us a little bit more about your new practice, where we could find you, and where everybody could come get some real treatment from you.
Well, it is brand new. It's called Bon Levin Healthcare. Bon Levin is a derivation of French and Dutch for good living, basically. And the website was available, so I took it. But what we're really looking to do is, grow the practice from a neurologic basis to improve and expand upon healthcare in exactly the ways we discussed today, where, it's a multimodal approach towards healthy living. It's healthcare, not sick care, as is normally practiced in this country. And so we just opened up in Maywood near Paramus, and the office is starting to see a lot of patients, and we're getting busy. But you can find me on the web, and you'll find the website and the information as well on the internet. I think that what excites me is this is finally a practice that I'm developing on my own. I'm the solo guy right now. And then as we grow, we're going to integrate partners under the same roof as we see fit and as we see appropriate. But I want to really, take it slow and step by step so that we can make sure that we give patients the kind of care that I want for my own family. And we treat everybody like family. And that's what we say when people come in. It's like, okay, now you've got a neurologist brother or you've got a neurologist son. So here's my cell phone, here's my email. You have a problem, we're going to take care of it together, but you have to take ownership of your health as well.
Great. So just for everyone, what was the website again? It was
bonleven.com.
Want to reach out to you?
Sure, 201-880-8060. Again, 201-880-8060. Thank you very much.
Well, Dr. Shah, thank you very much for coming on. Absolute pleasure having you, and hopefully you could kite you back as a repeat guest at some point if you have the time.
It would be a pleasure.
Busy guy.
Have a great day, John.
All right, thank you. Have a good one.
If you enjoyed the video, please share, like, and subscribe. Thank you.